I'm Stu Campbell-Carron and I'm from High Wycombe in Buckinghamshire. So sadly, my father had a stroke in 2012, which left him with cognitive issues, mobility issues, and brain damage. He started to recover and he was okay for a couple of years, but then dementia took hold of him and now he is very frail and immobile. So as a family, we have to rely on patient transport services to get him to hospital appointments for things such as blood tests. So in the autumn, I booked patient transport to take my father to hospital to have a heart monitor fitted because he had had several falls in the preceding weeks. Unfortunately, on this particular occasion, the ambulance and the crew with the wheelchair didn't arrive to collect him. So he got very upset and had quite a major panic anxiety attack. I called the patient transport booking line to express my concerns that the ambulance hadn't arrived to collect my father. After half an hour of being on hold, the person I spoke to wasn't very helpful and didn't really have time to deal with my concerns and actually put the phone down on me. So I phoned back and I spoke to somebody else who was quite helpful and explained that the crew had been delayed and advised me to speak to the Patient Advisory Liaison Service, otherwise known as PALS. So I phoned the number and a very lovely lady spoke to me and she asked me to explain what had happened with my father's incident. And she took lots of notes and she was very reassuring and said that she would do an investigation internally. I didn't expect to hear from them again, but then to my surprise, a month later, I had a follow-up phone call and she explained that my feedback had been used constructively to help improve training and communication processes. So for example, reiterating to crews that when they're delayed over a certain amount of time that they should send text messages to the family of the person if the person isn't able to communicate or manage their transport themselves. So yeah, it was a very positive outcome. Initially, I felt very guilty at the thought of feeding back on the NHS because obviously the NHS is one of the things that makes Britain great. However, I felt that this incident could have been so much worse and could have ended in a catastrophe ultimately, which is why I decided to take the lady's advice from PALS and to feedback. I think it's really important to continue to share feedback via the Care Quality Commission, because ultimately that feedback is used positively and constructively to help improve patient outcomes and deliver better services. My expectations of care have not changed at all, really. They haven't lowered. In fact, I would say they've increased because I think the whole process of feeding back was so positive. And I've encouraged family members and other friends and people that I know have similar relatives, such as my father, to do the same, because I think feedback is a positive thing.